I was suffering from multiple issues like comorbid conditions and diabetes type 2, which was affecting my lifestyle and my overall career and studies. I'm from Manipur. I'm 24 years old, and I was, especially at this age, I was very lethargic, unproductive, and just unable to do day-to-day life. And after consulting multiple doctors, I came across Dr. Aloy Mukherjee.
Mrs. Priyadarshini, a 24-year-old young student from Manipur, had presented to me in the month of June 2024. What was important in this case was that this young lady, who was just 24 years of age, was morbidly obese. Her weight was about 117 kilograms, but considering her height was about 155 centimeters, her BMI was close to 49. Now, what I want to impress is not only her BMI. Now, along with this, she had some of the most dreaded complications of obesity, most importantly, type 2 diabetes. Her glycosylated hemoglobin was almost touching 13.
Having issues with like headaches, unable to sleep, breathe properly, and I found out that I had a high HbA1c of 12.5.
She had consulted a psychiatrist who had diagnosed her to have bipolar disorder, and she was put on numerous antipsychotic medications for the same. Now, for such a young age lady to be living with such comorbidities was something that no parent would like, and it was ruining the person's life completely. So we had to get her out of this. So we decided and we got her test done, and this was a cumulative decision we took about for a gastric bypass surgery.
It was decided very quickly that this bypass surgery has to be operated upon her, to rescue her from that severe conditions.
Now, following a Roux-en-Y gastric bypass, there are different types of gastric bypasses. I preferred to do the Roux-en-Y gastric bypass. Now, with the Roux-en-Y gastric bypass, not only she lost about 20-25 kilograms in 4 months, most importantly, her diabetes was resolved. She did not require any medications for her diabetes. Now, understand this, for a lady who was dependent on insulin at one end of the spectrum, about 4 months back, to be completely resolved of diabetes, it is a blessing. It is a boon to the patient.
And now I can finally do the things that I wanted to do, like go for a walk, like a longer walk, not just 5 minutes. And I can do the normal things that normal people do, like sit for a long time, study, focus. And now I can finally have a good night rest.
So what I want to impress is, if you have patients who has these kind of a problem, who has obesity associated metabolic syndrome like diabetes mellitus, obstructive sleep apnea, mental disorders, GERD, all of these problems can actually get resolved with weight loss. Now this, and at a young age, if we address this, the quality of life which the patient has drastically improves.
Like the overall life quality has improved, and I have to say thank you to Dr. Aloy and his team and Apollo for being there for me and just guiding me through this healthier life journey.